Talk more about pancreatic cancer is Dr. Wasif Saif, a medical oncologist who is the Deputy Physician-in-Chief for Northwell Cancer Institute. Dr. Saif, thank you so much for joining us.
Thank you, sir.
Doctor, first off, let's talk about pancreatic cancer. Obviously, Alex Trebek made it known that he was battling this type of cancer. Stage 4 is what he told us all. Tell us, at that point, what is the prognosis for someone, I guess let's start with Alex Trebek, later in life in his 70s?
Unfortunately, pancreatic cancer is a disease of older age. And historically, it was a disease seen in the 7th decade or the 8th decade. We are definitely seeing a trend towards earlier age. When somebody is diagnosed at the later stage, mostly stage 4 like him, with liver metastases or metastases in other parts of the body, the goal of the treatment is really palliative. Because keep in mind that pancreatic cancer not only affects the lifespan, but also causes a lot of symptoms that includes the functioning of the pancreatic gland as well as diabetes and many other constitutional symptoms. So I think Alex has done, on an average, very similar to what we expect from a patient who is able to receive most of the therapies and able to live for a year plus.
What we know about Alex Trebek is he obviously made us all feel comfortable, and I would assume in his death he would want us all to have an awareness about pancreatic cancer. What can we do to be more aware? When do we need to start screening ourselves for pancreatic cancer?
I think that's a very important question. Unfortunately, there is no gold standard for screening in a patient with an average risk. However, patients who have history of family members in the first degree relatives, particularly with pancreatic cancer. We also know that patients with chronic pancreatitis, these are the patients with these risk factors can be exposed to pancreatic cancer. We also know there are a lot of genetic syndromes, such as the breast cancer gene, BRCA1, BRCA2. And I think more importantly, we're also learning that if somebody is losing weight without any intention, and also if these people are having issues with appetite, that could be one of the red flags that somebody is developing pancreatic cancer. Lastly, we also learned that over the last few years, and particularly the last 2 decades, I would say, that patients who develop new onset diabetes, if they don't have any family history or if they are not obese, that could be one of the signals that somebody may be developing pancreatic cancer. But at this time, other than patients with high risk, there's no screening guidelines or any other advisory that I can give to patients other than just like be very vigilant. And if you develop any symptom that you have no explanation, seek medical advice.
Dr. Saif, is there anything preventative that we can do to ward off the possibilities of pancreatic cancer?
Definitely. We always talk about smoking, alcoholism. It's not only that these things cause tumor in the lungs or the other parts of the body, but smoking and alcoholism are also definitely contributing to development of pancreatic cancer. We also know that, as I mentioned earlier, chronic pancreatitis. So people who are developing pancreatitis, which is an inflammation of the pancreas, and end up getting to the hospital for multiple times, those people could also be the one who may be developing. But I think above all, I think we need to also keep in mind that if one of our family members is diagnosed with breast cancer, ovarian cancer, or sometimes colon cancer, or prostate cancer, and similar cancer like that, it is very important to seek advice from genetic counselor. If you are able to follow through that thing, you may be one of those high-risk patients who can really go for screening and try to prevent yourself to be diagnosed at a later stage.
At what point, if you're at home and you notice some irregularities with your body, is it time to go get screened, get tested for pancreatitis?
Sadly, the story we hear every day is very similar. I've been dealing with pancreatic cancer for now 2 decades. The most common scenario I hear from patients that they were trying to lose weight because they were developing new onset diabetes, and then they realized that they keep losing weight despite they were not making much effort. The second thing is that, people having a pain in the abdomen or back pain, and they feel like this pain is very unusual. I think that could be another signal. So I think what I always say that when you really suspect about the culprit, think about, what that culprit is located. What's the location? We know that pancreas is located deeply in the abdomen, so it means that, it can affect the surrounding structures and can lead to pain. So pain is a very commonly seen symptoms and sign in pancreatic cancer. The secondly, I mentioned earlier, new onset diabetes in somebody who's lean or does not have a family history. But other than that, this is a very silent disease. So I think just having awareness when you have new symptoms, you definitely need to seek medical advice and get tested for that one. And last but not the least, being very aware of what's going on in your family is very important. We should be close to our families irrespective, but I think it also is very important to be close to your family about knowing what's happening, what kind of illness is happening in the family. So definitely you can really seek out your physician and make sure that you don't have any higher risk.
Dr. Wasif Saif, thank you so much. We appreciate you taking the time here on News Nation.
Thank you, sir.